This video encourages focusing on positive aspects of life and abilities, especially in the face of challenges. However, we recognize that this approach may not be appropriate or helpful for everyone, particularly individuals living with chronic depression or other mental health conditions. If you're struggling, please know you're not alone. We encourage you to seek support from a mental health professional. Your experience is valid, and healing looks different for everyone. If you need immediate help, please call or text 988 for the Suicide and Crisis Lifeline.
So far in this course, we have looked at the impact that chronic pain from Chiari can have on a person, the physical disabilities that often come with Chiari, and the cognitive impact of Chiari. In this final module, we'll take a look at the psychological impact of Chiari. Like with many other chronic painful conditions, Chiari patients suffer from high levels of depression, anxiety, and stress. But what does this actually mean? Depression is defined as a mood disorder characterized by persistent sadness, which interferes with everyday functioning. A Conquer Chiari research study of over 1,000 adult patients which used a common depression scale found that 44% scored as being moderately to extremely severely depressed. Interestingly, there was not a significant difference in the rates of depression between patients who had had surgery and those who hadn't. That means nearly half of adult Chiari patients have depression at a level that should be addressed by a mental health expert. Clinically, anxiety is defined as excessive, persistent, and often unrealistic fear or worry about future threats, leading to significant distress and impairment in daily functioning. The same study found that 60% of the adult patients scored as moderate to extremely severe on a widely used anxiety scale. This means that more than half of adult Chiari patients suffer with anxiety at a level that should be treated. Among the same group of patients, 63% of adult women and 67% of adult men were found to suffer from severe to extremely severe levels of stress. Finally, 3 out of 4 adult women reported high levels of loneliness. Although it is rarely talked about, the combination of physical disability and psychological distress caused by Chiari leaves some patients at a higher risk for self-harm and suicide. In fact, a Conquer Chiari study of 372 adult patients, which included a suicide risk screen, found that 44% were at an elevated risk and that within the previous month 43% had either wished they were dead or had suicidal thoughts. Those with a moderate level of depression or worse were 4 times more likely to be at higher risk than patients with low or no depression. In addition, those under the age of 30 years were 3 times more likely to be at risk compared to older patients. And those with severe or complete neck-related disability were twice as likely to be at higher risk than patients with lower levels of disability. While the mental health impact on adults has been well characterized, as with other aspects of Chiari, there is less information available about the psychological impact on pediatric patients. Although it is based on much fewer patients, data from the Chiari 1000 project indicates that depression and anxiety are also a serious issue for at least a portion of young patients. In addition, there are indications that there are higher rates of attention deficit hyperactivity disorder among Chiari children, which can lead to behavioral challenges in the school setting. However, much more research is needed on pediatric patients to understand the situation and provide parents with the information they need. Despite the obvious need, the mental health of Chiari patients is largely ignored by the medical community. However, Conquer Chiari has funded a series of studies which have shown that a self-guided program of acceptance and commitment therapy can be effective in improving Chiari patients' lives. Acceptance and commitment therapy is a mindfulness-based therapy that helps people build psychological flexibility in order to live valued, meaningful lives. This is accomplished by focusing on accepting difficult thoughts and feelings rather than fighting them, and committing to positive actions rather than trying to eliminate distress. Conquer Chiari is working on a web-based, self-guided, Chiari-specific program that we hope to roll out by the end of 2026. This course included a lot of disturbing information about the impact that Chiari can have on patients. While what was presented is based on research, it is important that patients and their families do not lose hope. You don't have to let Chiari take over your life, but understanding it is a good first step to conquering it.